I hear you again, Ben. Why?
It only has one setting.
But I hear it.
It's on or it's off.
Now it's better. But maybe if you're...
Okay. So attractive. So in Canada, we all walk around with little black boxes in front of our face because otherwise people can't hear us.
Okay, we try. So what you were saying, it's like the US and Canada, it's different, no?
Yes, it's very different. So I know US is having a lot of headlines, but not all of North America is the US. I think in many ways we compare far more with European measures and expectations. We don't have a lockdown the way it is in some countries that leaving the house you have to explain where you're going and why you're going there. People are by and large self-isolating and staying home as much as possible, but nobody is here to enforce it. I think in that way it probably compares more with Germany than it does with Spain. Right. So what I'm looking at, what I see from the outside, what's going on in those countries. We started, so in the curve, the development of the pandemic, we are a bit behind Europe, but we pretty much closed down at a similar time, right? So I actually thought it's possibly interesting to you to have a very specific perspective. I work in a public library. Public library here is very different from a lot of places in Europe. It's open 7 days a week. It's open in the evenings. The branch I work at, so a library system in one city has several branches depending on the size of the city. I do work in an urban context, and the branch I work at, approximately 10,000 people a week come through. Just sort of an idea of scale. It's not a quaint little spot where a handful of people come to read some books. It's a community hub. There's a lot going on. It's not a community center. A community center is a completely different species. But it is a community hub.
So what has changed now?
So that has changed drastically. On March the 16th, that was a Monday, since that day we're closed. Our virtual branch is open. So all the e-resources, e-books, e-audio books, online learning, all of those things are available. And there was such a surge in interest. Within those first 2 weeks, we put a lot behind the e-resources and significantly increased the e-book collection because people still want to read, luckily. That's a good thing, yeah. Right? And it's interesting, so the vendor who we're with, of course, supplies a lot of libraries, and there was such a surge in demand that they had to spend one weekend in early April just adding a lot more servers to their to what they already had to make it possible, because the site kept crashing. Suddenly there was so much traffic. Right?
So what do you think now? How will it change? Because it's not possible to bring the people together, no? Or will you be only virtual, or how will it change now?
That's where we are right now. We are trying to do programming. It took a while to get it up and running, right? What are good ways of doing it? What are safe ways of doing it? And of course, it's quite different to do a children's story time online rather than in person where you see and touch them, and they run up to you and they're like, "Oh, that's my favorite book," right? We're trying, but really, I think our underlying question is how can we still serve the community, right? And one way to do that is to make sure we are providing links to solid information. Not all information is equal. I mean, you certainly know that in your profession. And how do people find which source, right? That's one thing. And we called up the people from the book club to have a conference call, book discussion. And because one big thing we can do, what we usually fulfill in the community and that we now try and find ways to do virtually, is to connect people. The physical distancing that we practice makes it very easy to feel isolated. And that doesn't help anybody, right? That is emotionally, mentally very difficult to manage over time. So we really were looking at how can we connect and make sure people are still feeling part of the whole, right? Now we're also putting up some STEM programming. We've made it very easy for people to get their library card online, those who don't already have one.
Do you think that this will be now forever, like, well, half a year, 1 year, or it's only
the closing? No, I don't think so. And I'll get into that in a moment. But I do think this uptake of virtual services will continue. It might drop a little bit from where it is now, but it will remain higher than it was March 15th, right? So then we've had these updates ongoingly about now we're remaining closed until this time, and it gets pushed out. And I'm sure a lot of people are familiar with this wherever they are. That's certainly a shared experience for a lot of us. Now, during that time, that then also guided us in if this is longer than 2 weeks. So now what do we do, right? Opening will be in phases. We had last week, May 14th, there was an announcement that libraries can offer curbside pickup, right? So we're working currently on what that looks like, how we make that possible. It involves a skeleton crew of people coming into work and setting that up. We need a process for it. What does that look like, right? So that it can be contactless. We don't really want to mingle with our customers right now. We're working on that, and we're looking at what are the different stages. So first, going in and cleaning up what was returned. I only go in now every other week roughly and empty the book drops, because although we told everybody they don't need to return their books right now, there won't be any fines accumulating, and we've set everybody's due date for their items to September. Just who knows how long this will be, we can always change it, right? But just so people don't get worried about fines for overdue books. When people are returning them anyways. So then I go in sometimes every other week and pick them up, get them out of the way so it doesn't overflow, and basically quarantine what I picked up.
But and, this will be for the future, I suppose that in 1 year you have to sterilize all what they do and what they take and so on.
And that's where we're watching very carefully any new information that comes through about transmission. How does that work, right? So when I pick up the books wearing gloves and putting them away, and right now nobody else is in, and I only go in after 2 weeks, right? So that's when there should be no lingering virus on it. So we will need to, when we go in, to offer some kind of service where material goes out, whatever comes in, we would be in more often. And whatever comes in, we're setting aside an area as a quarantine area for the books. And when I say books, I mean, you know, magazines and DVDs and whatever, materials. To make sure that that's safe to touch, even though we will touch it with gloves, but it's safe to process and put back out again.
Julie, one question, because I would like to start from the beginning. You are in Canada, but in quite near, I think, from the US, from the border.
Yeah.
So can you tell me, because Canada, I read that they have much less infections and death tolls and so on. What was the main difference between the health systems of the two countries, and also now the attitude towards the COVID disease?
I think a big difference is that decisions are made based on medical information, not on politics, right? There is an update every day by the Prime Minister, and then the Premier, who is sort of the head of the province of Ontario, Premier Ford, and they let the medical experts speak. They let their information guide the decisions, and there's really a sense of things being decided for the greater good, right? The border to the US is closed except for essential services, which looks a bit different at different borders. So for one thing is trucks, deliveries do come through both ways. We're also in a situation, there's a town in Ontario called Windsor, which is right across the river from Detroit in Michigan. And several thousand Detroit nurses actually live in Windsor. So they cross the border every day to work. Over here, there is also a sense, you have the odd person who thinks this is all a hoax and somebody's just concocted this story. You do have the odd person who thinks that, or is at the front of a grocery store and argues how they don't need to wear a mask. They're a free citizen in a free country. But that's the outlier, that's the exception. By and large, people understand that the best thing we can do to help right now is to follow these rather simple instructions. And really, when you think of it, the best way to help is to just stay home, right? That's fairly easy.
Yeah, it's very easy. Well, give me a second, because it's somebody speaking very loud, and your sound is not so good. I will close the wait a minute. Yeah. I'm back because it's quite hot, and I had the window open, but he was speaking so loud. So I suppose the Canadians, they were very proud to be Canadian now, and they don't want to be mixed up with the US or what?
We usually are. We usually are. There is, the US didn't have that coordinated federal response, right? Quite the opposite, that governors in their states who wanted to do something actually were hindered or challenged. Versus here, there is a sense of this is beyond politics, so let's deal with it from a point of humanity, right?
But Julie, one question. The difference between the US and Canada is also the health system. In Canada, we have health system, or how is it? No,
we have a provincial health system. If you are a resident of Ontario, then you have health care. Healthcare doesn't include dentistry, but you have a family doctor. You can show up at the hospital. The ambulance will pick you up, although the ambulance will send you a bill later, but it's covered, right? When you go to the emergency room, you fell down, something needs to be done, that is covered. A lot of people through employment, especially white-collar jobs, have then additional benefits based on their employment, right? So that then might mean that you have a room you only share with one person at the hospital or something like that. But the basic care that you're eligible for a test, if you need, I don't know, a CT scan, well, your doctor books it. It will take a long time before it becomes available, but everybody gets it the same, right? And that, of course, also has really helped with a response across the whole system. So again, this is province-wide. This is not federal. The health insurance, every province has their version of it, though. Versus in the US, you have so many hospitals that are private corporations. They are not sort of part of a government initiative in any way. That of course makes a big difference in where they are and who they are available to.
Canada, you think that the people are more solidary or they hear more about the common sense, that they think more about the other person, and so they do the lockdown on their self, so they don't need so many rules? Or
well, I think for one, it is easier to believe the news that are shared when you see that it is a non-political response, right? Whereas if you have countries where every time the government changes, that group that they represent is the ones getting all the benefits and the advantages, who do you believe that this is not just good for them, but that this is really good, right? I thought about this because I encountered two people this week who were telling me that this is all just some hysteria and not really a thing, which I have friends in the medical profession who work in hospitals. This is real. I know what they're going through, and they're not making it up. What the decisions they have to make going to the hospital every day, whether they should come home to their families or just bunk in with other hospital staff somewhere. And they have to make a lot of hard choices, not even related to the patients, but for their own life, right? So they're not playing with this. This is real. So meeting these two random strangers at a very safe distance, telling me that they think this is all nonsense, I thought part of it might be the conditioning, how you grew up, whether you grew up in a way that you felt you can believe government. And if you didn't have that, will that ever come to you, right?
But these two persons, were they very for you the typical Canadian person, or were they normally they think all the Canadians think like you, and these two people are not very representing the Canadians?
No, I think the majority of people do believe it and do the necessary steps, right? Take the necessary steps. They have their masks ready when they go grocery shopping and stay home as much as possible. I do think that is the majority. That's why it was so odd to me when I went to the library this week, and a security guard working the building was one person, and then in the parking lot somebody else who saw me fumbling with these gloves, the plastic gloves, and I'm not very good. It looks very awkward, like a Mr. Bean performance with vinyl gloves, and he was laughing at me, which I can see that it's funny, but then when the commentary from him, how clearly I'm very gullible, that I fell for all of this nonsense, had got me thinking, like, where is that coming from, right? That you think this isn't real.
And these friends of yours, are they telling about very dramatic situation, or like just in the limit? Because you know that in Spain it was very dramatic, but now it's all under control in Canada.
We did manage to flatten this famous curve, right? So the system, as far as I can tell, I mean, the system might be called on very heavily, but it's not overwhelmed, right? And I think part of that is that measures were taken quite early, right? So if you think your country would have closed down 2 weeks earlier than it did, right? A problem is for us here in Ontario, actually British Columbia at the West Coast seems to be really good at this, but it seems to be an issue in Ontario that we don't know where the new infections are coming from. Right? It's easy to sort of say, okay, these people traveled or were in touch with somebody who traveled, but the new cases were not entirely clear how they got infected. And that was a bit of a discussion this week, because if we don't know how people get infected, how do you know where you can safely go, right? And a big thing is also the change in weather.
There was a study in the medical journal that some Canadians said that the temperature doesn't affect COVID. This is what.
Yes,
no?
Yes, and we're very disappointed about that, right? Because the winters are long and cold, and in summer is really when you're out and about, right? It's not a year-long thing. I mean, it's so much work to go out when you have to put on 15 layers.
Julie, one question. What do you think? Do you think there is something positive from this crisis?
I think the human spirit is resilient and will find a silver lining, right? Those positives in any way make up for the suffering and death and lingering sickness? I don't think so. I'm thrilled to see the natural world coming back, because we're not taxing and poisoning it, right? So to see, I don't know, dolphins in Venice, that's amazing. I do think it's great that Mother Nature gets to take a deep breath, because we were all stopped in our tracks, right? But that something comes good out of it doesn't necessarily mean that it was a good thing to have happen, right? I mean, when we see that it's not like the flu, that you have it and if you survive it, you're immune and then it's fine. Turns out there are lingering long-term effects, right? I think we can find why it isn't all completely terrible. I really relish with my team. So the branch I work at the library, there's a team of us of 30 people. And we've really taken a lot of steps to stay connected and to check in on each other. And might even have grown closer, right? Because before it's busy, you have a lot to do, because there's a lot of shift work with evenings and weekends, people come and go, versus now we all sit together regularly online in a video call and just share, right? In an environment, I'm very lucky. I work in a team where people are very authentic and very honest. But I've had conversations, or I know now things about people I didn't even know before that delight me, right? So that's not terrible. Doesn't make COVID a good thing.
Julie, one question, because we wanted to start also to ask for the solutions, not solution, but how do you think some of the countries are going out now from the lockdown and so on? How do you see some solution, for the world in itself, or your country, or whatever?
Well, in some countries, it was already custom that when you leave the house, you wear a mask, right? And maybe that's a new thing, right? At the supermarkets, between the cashier and the customer is now that plexiglass divide, right? So I think we'll all be a lot more implementing those types of things, because why not make that a standard? It's plexiglass. I can still see you. I can still talk to you. We're not losing human connection because of it, right? And I think that's a good way to go, because there's also talk that this it might not always be this harrowing and global, but that there will be more new viruses wearing their ugly little heads. It seems that more people will be able to work from home, where before it was said that to be productive you have to be here, which would then unclog cities quite a bit, right? I mean, what that brings with it, talking about commutes and so on, right? I think there will be some minor adjustments. I don't think, and that's one thing I keep saying in staff calls, where it's like, when we reopen, it won't be like going back to March 15th. It will be different, right? The programming will be different. How do you get together with people in groups, right? So I do think this will have lingering effects. We won't be in this state forever and ever. But then there's, of course, the economic impacts, right? Just seeing how which companies and which industries have what kind of survival rate for their businesses. Also psychologically, how it informs how safe is it to be an entrepreneur. Will we lose some innovation and some entrepreneurial spirit in this, right? And I think that will have a lot to do with seeing what shape small businesses are in after.
Yeah.
Right? Not that I'm an expert in any of this.
No, but this should be okay. So thank you very much. I hope that the sound is okay. Yeah. Sometimes we see you with this and then without, but I will try to cut it. So I stop the recording now. Thank you.
Okay, thank you. Bye.